Hi, I'm Dr. Noelle Lucas from Blue Oasis Pet Hospital, here to answer some more questions that you might have about cat anesthesia, specifically safety.
Dr. Lucas, what are some of the risks of anesthesia?
So some of the risks of anesthesia, there are real risks. So one of the things with anesthesia is your cat is unconscious and it can't move its body. So we're going to be very mindful of hypothermia, so low body temperature. We also need to control our airways. So we're going to put an endotracheal tube down into the trachea. But because we're doing something to the trachea, we can sometimes see coughing. And because there's communication between the back of our throat, between our airway and our stomach and our esophagus, we can sometimes see risk of maybe aspiration pneumonia, so fluid that can get into the lungs because an animal can suck it back in, especially during recovery. So that could be a risk. We are changing heart rates and blood pressure, so we can have arrhythmias develop during anesthesia. We can have low blood pressures. There can be some sort of kidney injury that can happen. So there are real risks with general anesthesia.
How will my veterinarian talk to me about the risks? How will you talk to me?
Well, just kind of like we have right now. We want to make sure that you understand there are risks when you go into, a cat goes into general anesthesia. A veterinarian should never really gloss over those risks, meaning we know how to mitigate risk. We are very confident doing so, but there are real risks and we want you to be aware of them. If you have specific questions, or if you had a patient in the past or a pet in the past that has had general anesthesia complications or even died under general anesthesia or after anesthesia, clients carry that memory forward and sometimes aren't always forthright with their veterinarians in talking about it, but we want to know your past experiences. We want to help you feel comfortable with us putting your cat under anesthesia. And one of the things that we do here at Blue Oasis that is unique is we allow you to stay with your cat while they're going through a general anesthesia procedure so that you're able to see what we do to help mitigate those risks and keep your pet safe, but also just be here to ask questions as we go through the procedure with your pet.
Are there specific breeds that are high risk under anesthesia?
So for me, I don't really think of different cat breeds having higher risk, but we do know that the brachiocephalic breeds, which are the smushy face ones like the Persians, the Himalayans, those cats tend to have more restricted airways, so airway restriction in their nose, and they have a little bit more compromise in their back of their throat because of just their smushy faceness. So they could be considered a little bit higher risk. That's really the only ones I really think about, maybe keeping their tubes in maybe a little bit longer so that they're able to regain their airflow and airways control better.
What can be done to minimize the risk and the side effects?
So mitigating risks and side effects. Number one would be having a complete health exam on your cat before considering general anesthesia to just know how healthy is this cat physically. We also are going to recommend pre-anesthetic blood work so we can see what is organ function happening and making sure we're not having some hidden diseases, because again, our cats can't talk to us and say, you know, I've really been drinking more lately and urinating more because my kidneys are starting to have some disease process. So we will look at that blood work to help us guide us for health. Another thing we do here is we'll do an ECG. So we're going to look at the cardiac rhythm and make sure our rhythm looks really good before we go under general anesthesia. We also have a cardiac or biomarker for the heart called a cardiac proBNP that is included usually in most of our pre-anesthetic panels. So it's another way for us to check that heart health before anesthesia. So again, physical exam, pre-anesthetic blood work, ECG are good ways for us to know what's your pet's health status before general anesthesia.
Is it possible that my cat could die?
That's a very, very serious question. Can your cat die from general anesthesia? The answer is yes. It is a very, very minor risk if all of the precautions are taken, but the answer is yes. Veterinarians are not gods. We are simply medical professionals trained in all the medications and drugs that we use, and we also are trained in how to mitigate risks and help encourage safety. But there are things that are out of our control when an animal is under general anesthesia, and anesthetic death, although it's rare, is a real risk of general anesthesia. So on that note, if you have concerns about cat anesthesia and really would like to talk about it more, we encourage you to reach out, especially to us if you're in the area, and we're Blue Oasis Pet Hospital, and we're here to help.